Welcome to the webinar number 211 of the Andean Health Organization Hipólito Unanue Agreement, the ORASCONU. It is more than 3.5 years of continuous learning since we started this webinar cycle in May 2020. Today, Thursday, March 7, 2024, we will talk about women's health and well-being to the life course in the framework of the International Women's Day, a date that commemorates the struggle of women for equal rights, opportunities in all areas of society. Women's Day is also a call to action to eliminate all forms of discrimination, violence, and exclusion that affect women and girls, and to guarantee their full exercise of their human rights. It should be emphasized that positive peace implies not only the absence of violence, but also the presence of conditions that favor comprehensive human development. It is essential for the well-being and health of people, as it allows their rights to be respected, their needs to be met, and their capabilities to be enhanced. It also contributes to preventing and reducing risk factors that affect physical, mental, and social health, such as poverty, inequality, discrimination, stress, and trauma. Therefore, from the Andean Health Organization, Hipólito Unanue Agreement, we promote positive peace as a fundamental value to achieve comprehensive and sustainable health in our region. For us, it is a priority to contribute to ensure that public policies are effective in guaranteeing human rights, especially the rights of boys, girls, and adolescents. Likewise, it is essential to strengthen intersectoral and transdisciplinary work capacities, regional integration, and international cooperation to make social and environmental justice a reality, as well as to understand that children and adolescents are not the future, they are the present. Reflections on these and other priorities relevant to health and well-being can be found in the Bulletin of the Salud Andinas monthly edition, available on the website of the Andean Health Organization and in the Andean Integration Knowledge Showcase. We invite you to leave us your name, organization, and country from which you are joining us through the comment box of the Facebook or YouTube live chat. In the same space, you can leave your questions or send them via email to webinarsorasconu@gmail.com. Test the certificate of attendance to this webinar as usual. You must fill out a short survey and leave your data in the fixed link that are in the Facebook or YouTube live chat. Please remember and please verify that your email is spelled correctly. This webinar has the following dynamics. We will start with institutional greeting, followed by the keynote dissertations, and then we will start the dialogue from the questions left by our audience. Begin this important day, I give the floor to Dr. María del Carmen Calle, Executive Secretary of the ORASCONU. Give the welcome and institutional greeting. Go ahead, Dr. Calle. Good morning. Thank you, Mari. Having some issues here, please give me a second. Well, good morning, good afternoon, good evening, depending on where you are. Today, very proudly, in the framework of the International Women's Day, we present webinar number 211, since we started its weekly broadcast in May 2020 with the objective of promoting continuous interlearning. Every year on March 8th, International Women's Day is commemorated as a day to promote gender equality and recognize the contribution of women to society. This year, under the theme Financing Women's Rights, Accelerating Equality, with a joint action not to leave women behind and to forge a better future. It is necessary to transform these challenges into opportunities. Investing in women is a matter of human rights and poverty and inequality. Implementing, transforming financing for gender equality. Moving towards sustainable development and a caring society. Support feminisms and movements that are driving change. A new United Nations analysis reveals an alarming deterioration in the health of women, boys, girls, and adolescents. COVID-19, conflict, and climate crisis exacerbate the reversal of children's and adolescents' prospects and women's rights, drastically diminishing their chances for healthy and productive lives. Women's health is a broad category that includes health problems that are unique to women, such as menstruation and pregnancy, as well as conditions that affect both men and women, but may affect women differently. Women and girls' health is influenced by sex-related biology, gender, and other social determinants. Women are longer lived than men. Non-communicable diseases remain the leading cause of death in women. Cardiovascular diseases are the leading cause of death among women. Depression is more common in women. The effects of sexually transmitted diseases can be more severe in women. 1 in 3 women may be physically or sexually assaulted at some point in their life. In households and communities, women are the primary caregivers. There are important differences between women and men in terms of health needs, problems, and access to resources, as well as with regards to mortality and morbidity. These disparities are rooted not only in the distinctive biological traits of each sex, but also in the social patterns that regulate gender relations. The information available in Latin America and the Caribbean show that women are at a disadvantage with respect to control of the resources necessary for health protection. Similarly, it is clear that their contribution to the development of the health and their families and communities does not yet enjoy fair recognition and social support. Women continue to be a minority at the highest levels of decision-making, autonomy, prestige, income in the health sector, despite the fact that the composition of the sector is a majority and increasingly female. The Andean Health Organization, Hipólito Unanue Agreement, has been working on regional public health policies, responding to the needs of the countries that make up this organization, thus contributing to improve the health and welfare of more than 169 million inhabitants, with emphasis on the empowerment of girls, child health, adolescent health, maternal health with a life course approach, and the right to health, among others. In this opportunity to address this important health issue, we have Dr. Maria Lucia Mesa, Professor of Social Pediatrics, Faculty of Medicine, University of Los Andes in Colombia. Dr. Farnaz Sabet, from the Center for Adolescent Health at the Royal Children's Hospital and University of Melbourne, Australia. Dr. Diana Torrecilla, Medical Auditor, Master in Occupational Health and the Environment. And Dr. Verónica González, Geriatric Gerontologist, Masters in Palliative Care and Pain Management, to whom we extend our warmest welcome and thanks for their participation. Thank you very much. Welcome, everyone. After the institutional greeting, I introduce myself. My name is Maricela Malki, Deputy Secretary of the Orascon, and I am pleased to be in charge of moderating this webinar. We begin the presentations to address the health and welfare of the women through their course of life with Dr. Maria Lucia Mesa. She will talk about the girl. Dr. Mesa is a physician and pediatrician from the Pontificia Universidad Javeriana of Bogota, Master in Gender, Society, and Politics from the Latin American Faculty of Social Science, Flaxo, Argentina. She has been a university professor for more than 20 years, jury and advisor of master's degree thesis in public health at the Universidad de los Andes, Universidad Javeriana, and Universidad Nacional de Colombia. Peer for the evaluation of articles in scientific journals and university projects. Experience at the national level in management of plans, projects, and programs of sexual and reproductive rights, with emphasis on teenage pregnancy and nutrition. He is currently a clinical professor at the School of Medicine of the University of Los Andes, Director of the Pan American Health Organization, representing Colombia, President of the Colombian Society of Pediatrics, Regional Bogota, the Colombian Group of Social Pediatrics in Colombia, founding member since May 2018. Welcome, Dr. Maria Lucia Mesa. Go ahead with the presentation. Thank you, Maricela, for your generous introduction. I would also like to thank Dr. Maria Carmen Calle for this important invitation on a very significant day, such as the commemoration of the Women's International Day. And as a pediatrician, I consider that we have to advocate and guarantee the rights of boys, girls, and adolescents. So I am proud to share this conversation with you. So I will start by sharing my screen. Would you please confirm that you can see? Perfect. Go ahead. All right. Thank you so much. So the title of my intervention is Girls' Health and Well-Being Through the Course of Life. That is the introduction to this interesting conversation where the experts that are here with us in this day, hopefully we will generate some messages and many questions, and above all, many intentions to work in the benefit of this important population for the world. Boys, girls, and adolescents are today because they must have the well-being and health and sustainability in terms of the environment. I would like to review first what I understand by course of life. Then 2014 was work in depth, where as a summary, The message that we want to leave from this approach is that everything that happens in the early steps of the course of life accumulate and are expressed throughout the years of the life of each person. Of course, all of this is influenced by health social determinants have different aspects to have more or less incidents depending on the situation of each boy, girl, and adolescent. So this important concept was taken up by the countries, and we have developed important public policies to benefit, in our case, in our discussion of today with boys and girls. I'm going to focus in the girls, and for that, I did some reference search to look at the indicators of health of boys and girls, and it is clear that globally, the World Bank shows us that throughout the years, we've been improving. Things have been made that have allowed that health has changed in terms of mortality rate, which is a macro indicator that I wanted to show you here. Surprisingly, I thought I was going to find other data, but the mortality rate of boys is of 18 in the Latin America region and the Caribbean for each 1,000 born alive. And you go to mortality rate of girls under the age of 5, we realize that is 14 is smaller. And this difference exists, but because children are under the age of 5, the indicators match and has to do with a social valuation of the children. So all the adversities in the adults, it doesn't make any difference between boys and girls. And when boys and girls grow up, there's an increase on the vulnerabilities, and there's an increase of the expressions of the indicators in favor of boys against girls. It is just a reflection to start. That's fine. Okay, what is the likelihood that people under the age of 5 can die in Latin America and the Caribbean? And I was reviewing a couple of countries where this indicator is highlighted by the World Bank as an important issue to consider. When we look at the world map, we see America of almost the same color. When we look in depth, we see there's a couple of countries which are in a clearer area than others, but one could say that America in general is doing well. But when you look at the magnifying glass to the countries, you see that, for example, Bolivia has twice the likelihood that the boys and girls died before the age of 5 as compared to Colombia, that had the indicator in 1, Chile is 0.5. So it's interesting to see that when we look closer to each country individually, the conditions and characteristics of the likelihood of living or dying for a girl are going to change. When I go to my country, Colombia, we see an area such as El Chocó department, which is in purple to the left of the map, which is surrounded by departments in green with a much better quality of life. However, if we put the magnifying glass in El Chocó, we're going to find high vulnerability like the Amazon areas with large indigenous communities that live in the desert with very poor living conditions. And so on, we're going to find a lot of differences. We think in girls, in health situation, we realize that the region has important challenges, many inequalities that require of the care and action from the different levels of society. I'm showing you a couple of pictures. This one you can see frequently in social media. The second one I really like, where you can see perhaps the bicycle used by the woman with a disability much more expensive than the one that the women use it but with no disability. But in order to have equity, they all have the capacity of being able to transport and mobilize. Here, I bring this chart prepared by Colombia Statistics Department in 2016, but I consider it very interesting is to realize and see how the interaction of so many things, from the person itself, the biological genetics, when they interact with all the socioeconomic background where you can live, grow, and thrive, if there are public services, all the environmental determinants that are more and more important in these times that we are living, and see how man is deteriorating the planet and how this has influence in increasing the likelihood of dying. So the invitation is to, when we are analyzing in what's going on with our populations, we can do it from a perspective that's from several disciplines, from different sectors, multi-sectorial, in order to have a more adequate look to what we are actually seeing. So in this world, the social determinants of health, perhaps the speakers that are going to follow me will tell you that when the mothers of girls have low education level, there's a higher probability that the health conditions are not as good and have a higher risk of having a teenage pregnancy or unplanned pregnancy or can die earlier, and that education of the mother more than the father, as studies have shown, is a determinant. And we realize with the PISA tests that are carried out in our countries, and we realize of the disadvantages that our region is, including the best country, which is Chile, still lagging the 10th country of the most developed, or at least for the top 10 worldwide, in areas such as math, reading, science. Fundamental for women and men, but also women, we can develop in the STEM careers that are more developed or have more boys than girls. So this is a call to focus ourselves in the importance that we as a health sector may have an interaction with the education sector, and we can find better ways to know what is what we need to make the difference in our country. So these are indicators that reinforce somehow what I just mentioned. This is the childhood mortality rate in 2019 in my country related to maternal age, and we can see were clearly influenced in the poor outcomes of health. And when we look, consider the disadvantages of people, we see how the gap increases. We go to the group of girls with disabilities. This is a survey made by WHO 7 years ago. We can see how women that have a disability, and these are girls at, elementary school, have a higher likelihood of dropouts from school as compared to those that don't have a disability. And for boys, they also have a disadvantage, those who have a disability, but it's not as large as for girls, just because of being boy. Once again, reminding you this topic that was very popular in 2011, the post-traumatic stress and how this permanent stress affects the neurological development and the way how all these neurons are deployed, especially in the first infancy, when there's this major opportunity for neurological development, and that can large opportunity of the early adolescence, and where there's a permanent stress, which is chronic, severe, it has a sustained development, this people's development is affected. And this is going to be associated with violence, which we see in boys and girls that are permanently subject to violence. We find that there is a number of significant consequences throughout the course of life. See how childhood and infancy and childhood, all these disorders are expressed in areas related to mental health. We have seen and we know how they has large consequences in the physical health, especially in cancer and chronic diseases. And that is a reality. In Colombia, my country, we issue a report on intrafamily violence against boys, girls, and adolescents to see who are affected more. We see that in that large period, there was greater effect on girls than boys in the different types of violence. And we're not going to deepen into that, but the fact of being a girl made them more vulnerable to be a victim of violence. And I always bring together with violence the issue of exclusive breastfeeding, because the evidence in the literature shows us that affective link, that possibility to be embraced and contained by the mother in the first hour of life, in the first weeks of life, and ideally in the first 6 months of life with exclusive breastfeeding, protects against many types of violence, protects against physical punishment in excess, something that in our countries is being eradicated. Our country has a new law that bans physical punishment and humiliating actions against boys and girls. So we're going to see what happens with the health indicators of women in the country after seeing some indicators where we realize what happens with the violence. And we see in the first causes of mortality between 5 and 44 years of age. There's something interesting that children are hit more and punished less, but are punished more strongly. We see these indicators of death cause related to violence in those under the age of 5. Another issue common to us is migrant childhood. In our case, we have the migrant childhood from Venezuela and the ones that come from different parts of the world to try to go from Colombia to Panama in a very aggressive jungle and go towards the US. And the migrants that come from Venezuela mainly stay in my country, and others continue walking towards the neighboring countries in Latin America. Girls at risk, all types of risk, not only sexual violence, which comes to our mind first because they're the most terrible, but also the risk for mental health, malnutrition, of living on the streets, are used for begging and other type of childhood labor. That is why here we see that from 2012 to 2023, there's been an increase in these migration groups in our countries. So it is important to reflect that indeed we've achieved significant progress. The statistics show we have indeed decreased the indicators of neonatal childhood and maternal mortality. They'll go hand in hand. However, we realize that the population group have not benefited the same. There are many major differences among in the countries and between countries. And those who have more vulnerability are more affected for these things. And by closing, I would ask you 5 messages. The importance of access to good quality and timely medical care. Boys and girls and everyone have the right to health. It's a fundamental right. But there are disparities in many circumstances and conditions in when girls arrive late to health care. We will also hear about the importance of guaranteeing the reproductive and sexual rights where although we have improved significantly in education and information, there's still large gaps that make that there is violence, that there's unplanned pregnancies, there's crime of sexual relationship with girls under the age of 14, either with or without consent, are banned. We are now discussing, because at this moment, in my country, they are allowing marriage from the age of 14 with parents' authorization, and we are promoting it to move up to the 18 years of age. So there are major gaps that we need to work. The other area is nutrition. Malnutrition and obesity are significant health problems in our region. Overweight and obesity increases sedentarism and screen time, because continuously changing issue and still a threat for our girls. How there's the importance of adequate nutrition for growth and development, and these behaviors are friendly to environmental sustainable. The issue of mental health in terms of depression, anxiety, substance abuse, vaping, tobacco is penalized, is taxed, but they use vapors as a alternative because they believe it's healthier, but we now know all the consequences that you suffer with vaping. And we see how factors such as violence, discrimination, and poverty have a negative impact in emotional well-being of people. And the fifth message is that we should continue to insist in health education and work at a community level, get to the homes of where the people live, and this is extremely important. Clearly, who does better? The one that has better opportunities. However, if we're going to study the social determinants of each one of the persons, I would like to stop in these two children in the middle. Perhaps the girl that's alone, sad, has witnessed violence. Perhaps the girls that are in a situation of poverty may benefit of a good program from the state. And it seems if they had well-nourished families and they look happy, and you could like to give them all the opportunities, and starts by giving them the rights of the girl next to them. So I would like to invite you to look in a comprehensive way. By summarizing and finishing, it is clear that in most of the cases, those who live in poverty do worse, those who have less education, those who belong to an ethnic or represent a minority, those who live in a disability or displacement migration, and if it's women and girls, it's worse. So it is important that governments, NGOs, society at large work together to approach all these challenges that imply to guarantee the health of boys and girls in our region. So let's not forget to put a magnifying glass in each particular situation, and I hope I can show you an overview of health for our girls in the region of the Americas. Thank you so much. Thank you, Dr. Mesa, for your wonderful and relevant presentation. We will ask you to stay in the room so you can participate in the Q&A. You have mentioned that although the health indicators in general have improved, there are still major gaps in the side countries, between countries, that needs to be approached with the first adequate policies in order to decrease those gaps and differences. Mention the importance of pointing out that there's a need to guarantee access to medical care, look after the reproductive and sexual health, consider nutrition, mental health, and definitely to insist in health education. And we must remember that those who are poor, less education, belongs to a minority or disability, or is a migrant, or is a woman or girl, it works. So we're definitely a long way to go and to work. Thank you very much. Doctor, please. Next is the health and well-being of the adolescent. We welcome Dr. Farnaz Sabet. Dr. Sabet is a family physician working at the Center for Adolescent Health at the Royal Children's Hospital and at the University of Melbourne, Australia, where she's also a PhD candidate. She has a Master of Science of Global Health Sciences at Oxford University, graduated in medicine with honors in Monash University, Australia. She has an extensive experience in comprehensive adolescent pregnancy care and in particular women's action groups and participatory learning. Also in global health, including clinical work with adolescents in diverse settings, rural, remote, humanitarian, indigenous, as well as policy and public health work for the World Health Organization, for the Department of the Prime Minister and Cabinet in Australia, and for the ACNUR, UNHCR. She has multiple publications on adolescent health in various international scientific journals. In her training, she has received several awards for her academic performance. Welcome, Dr. Farnaz Sabet. Go ahead, you have the floor.
Thank you so much. It is really a wonderful pleasure to be with you today in commemoration of International Women's Day, especially in a region of the world where I really admire the work that's being done in the Andean population and in Latin America. So it's really my privilege to join you, and I'm thankful that you asked me to speak to you today. So as in the introduction, I'm a family doctor. I'm based at the Center for Adolescent Health in Melbourne, Australia. And today I'm just going to talk about adolescent health, leadership, and empowerment in health. So our group at Melbourne led this Lancet Commission on Adolescent Health and Wellbeing, the Center for Adolescent Health. And I want to read to you one aspect of that commission. This generation of adolescents can transform all our futures. There is no greater priority in global health than ensuring they have the resources to do so. And at that time, the UN Secretary General, Ban Ki-moon, said young people are the world's greatest untapped resource. So I want to set that framing to begin with so that we can really think about young people now and young people that will be the future. So just a reminder for everyone, and I'm sure everyone is aware because we've all been adolescents ourselves, it's a critical stage in development. So many things are changing. There's brain maturation happening. This is region specific and non-linear. So different areas develop at different rates. There's of course hormonal maturation. And then at this point, there's an appreciation in the individual of biology, learning, and behavior. All of this is developing together. But in essence, it's a profound period of human growth and development in which the assets and capabilities that underpin future adult health and well-being, social relationships, parenting, and employment are established. So it's a really key area of health. And one way to think about it is the triple dividend, that when you invest in adolescent health, you get three main outcomes. One is the health of the adolescent themselves, which is critical, but then the health, the foundation of the health for adulthood, which also is foundational in fetal development, early child development, but really adolescence is the last stage that you can make a long-standing change to foundational behaviors and well-being. And then so the adolescent's health is one outcome, the adult health is a second outcome, and the third one is the next generation. So these two arrows going down go to investments for the offspring, the children of the adult. And what I will talk about today is the children of adolescence, which is this subgroup where Dr. Maria very nicely mentioned at the beginning, teenage pregnancy, adolescent pregnancy. So really maintaining health of the girl child at that age will really affect the offspring of her children if she has children at that age. So I think at the very beginning, it was a wonderful introduction, but we in the field of health can really see things either as a challenge or an opportunity. And for girl adolescents, every challenge we can switch to an opportunity. So during this period of life, as I mentioned, certain behaviors and an identity develops. So in terms of patterns of substance misuse, they normally begin in adolescence. Nutritional behaviors, they're solidified in adolescence. For example, obesity, anemia, iron deficiency anemia, injury and violence, which was mentioned very well by the previous speaker. These sort of relationships, the relationships you have with your partner, this behavior all starts in adolescence. Mental disorders, a large proportion in women begin in adolescence. Infectious diseases, so the highest incidence of HIV is in sub-Saharan Africa in adolescent girls. Malaria is also seeing a rise in adolescence. We have chronic physical conditions that, as mentioned before, there are some things that affect girls and things that affect both. And of course, sexual and reproductive health. And to note, it's menstruation that begins in adolescence and is really a key cornerstone of ensuring health of girls throughout their life, throughout their reproductive life course. So each of these areas we can think of either as a challenge or a risk. You know, how can we protect the girl from violence? How can we protect the girl's sexual and reproductive health? Or we can think of them as an opportunity. How can we establish a behavior at that age that's healthy in terms of relationships with others, that's healthy in terms of her consent for sex, for example, it's healthy menstrual hygiene behaviors, and a good relationship and identity that the girl has with her health. So this leads us to providing high quality healthcare for girls and for adolescents. So in this sustainable development goal era, high quality healthcare is not something that is only for the elite. As was mentioned, the disparities previously that we see in different areas and different countries in your region, we really need to now in this era think about providing health for all, regardless of their age, gender, race, disability, or any other factor. And it's not just provision of health, it's provision of high quality healthcare. And to provide high quality healthcare, we really need evidence. As you know, I'm a researcher also, and that evidence we have can really provide the leadership we need for change. Now, Latin America can really lead the way in this field because you have a history of Latin American social medicine, and it provides a different narrative, a different way about thinking about the provision of care. And I'll highlight this soon. So we did a review, a very big review, to look at what do we know about providing healthcare for pregnant girls. This was published in The Lancet in October last year. And we really find that globally, we have very little evidence. We might be caring for pregnant girls. They're part of the teenage health clinic or part of the maternal services. But evidence in terms of providing good quality care is very little. This is despite 21 million pregnancies annually in the globe in adolescent girls, over 12 million births, and 1.3 million of those births are in Latin America and the Caribbean. And we know that these girls have poorer maternal outcomes and poorer outcomes in their babies. The other thing that why I want to focus on pregnant girls in this talk, and it's my area of work, is that they face often discrimination, not only for age. So many studies have shown that a girl presenting for delivery faces more abuse from healthcare staff than an adult presenting for delivery. So age is a factor, gender, she's a woman, but often these girls in many countries in the world come from races or ethnic groups that are also discriminated. So the girl faces multiple discriminations. So what we did is we saw, what do we know about providing care for them? But at the same time, we also thought, well, what should we be providing? What is high quality healthcare for these girls? So first we looked at what do we know about provision of care, and this is the global map of the different studies over 20 years that looked at providing care for pregnant girls. We not only looked at specific programming for pregnant girls, but also if the maternal health study analyzed specifically for pregnant girl outcomes. And it's very sparse. And in fact, the leaders in the world that we found were in Latin America in terms of the number of studies, but in general, the quality of the evidence everywhere was poor. So as I mentioned, we wanted to know what we're doing, and we found big gaps, but we also wanted to look at what should we be doing. So we drew on the high quality health system framework for the sustainable development era, and we adapted this for pregnant adolescents because pregnancy needs different care. One, for example, is coverage of key practices. When you're pregnant, it's very important that you go through all the antenatal visits and postnatal care. So coverage is an important concept, which wasn't there in the original framework. And then as an adolescent, you have other needs that the healthcare system needs to respond to. For example, the need to have peer education or group support. And I'll go through why it's important at every level, every stage of healthcare in a woman's life to think whether our service provision is meeting her need. Because at every stage, the need or even the development of the woman from childhood to adolescent changes. So her health needs and the health service needs will change. So this framework really helps us think about the health across a woman's life course. So when you're an adolescent, which is the darker section here, you have a much bigger influence from your peers. So we also need to think about that in the provision of healthcare. You also in adolescence have a lot more media, in particular social media influence. So this needs to be considered. And education is still very important, but not as key as in the early years of your development, where it's very critical. You have high quality early childhood education, but education is still key. And employment starts to begin an influence on the social context, but family is also in transition. So as an adolescent grows older, they start to form their own relationships and partners and start to develop their own families. And the family of origin becomes less important. So and then of course you have the community and structural determinants. So because these things are so dynamic, you really need local context. What I provide for adolescents in Australia will be different to what adolescents in Colombia or Peru will receive. And to understand this dynamic relationship is very important in the provision of healthcare. So for pregnant adolescents, what does this mean? Well, one, if we look at that dynamic context, is that when she becomes pregnant, she's still an adolescent. The pregnancy doesn't suddenly make your brain into an adult brain or your thinking into an adult thinking. Whatever the circumstances or the structural conditions or the poverty that has led to the pregnancy, that pregnancy itself doesn't change her conditions. So when we provide healthcare for a pregnant adolescent, for example, we still need to think about peers. She still wants friendships, group support, youth-friendly care, and also engaging her family and community rather than just her. In many studies, and many of them actually came from Latin America, if you engage the girl's mother, her healthcare outcomes were much better than if you just engage the girl herself. So I want to switch now a little bit to Latin America because I think this was very important in the study that we did and very important when we think about providing care for women. Most of the studies from everywhere, except for Latin America, treated adolescent pregnancy as a social problem. And it is really a condition of structural poverty in gender inequality. But there were half the studies from Latin America that saw interaction with pregnant adolescents as a privileged space. They treated the girls very differently to any other study from the rest of the world. This type of thinking, this thinking that we as health professionals are privileged to engage with anybody, regardless of their background, regardless of the condition that they've landed in, changes the way we provide health for them. So we don't see the risk, like I said at the beginning. We don't see, oh, this is risky. We need to protect the girl. We need to do these things for the girl. We see how can we respond to the aspirations and needs of the adolescent. So there was a intervention in Brazil that looked at reducing gestational weight gain during pregnancy, and it didn't work. And they provided nutritional consults and all of these services. But because they treated engagement with pregnant adolescents as a privilege, not as a problem, they evaluated that the problem with the intervention was not the adolescent girls. The problem was with the doctors and the health providers who were so disconnected from the reality of the world of the adolescent girl that they couldn't provide effective intervention for her. That's very different to other studies, which will just put the blame on the adolescent girl for not responding to the health intervention. So moving forward in adolescent healthcare and advancing gender equality, what are some things we can do? One is really a recognition that adolescents are adolescents. Pregnancy doesn't suddenly make you an adult. You know, I work in India also, where there's a lot of early marriage, and getting married early also doesn't make you an adult. A lot of developmental needs and like I said, hormonal maturation, brain maturation are still occurring. So we need to give recognition that at different stages of a woman's life, she has different needs, and adolescence is definitely one of them. There's also recognition that if we want to move this work and services forward, we have some traditional biases in our provision of care to girls. There's certain narratives about what girls should be and what they should become, as in adolescent pregnancy. This sort of narrative, you know, there were many studies that were providing interventions for pregnant girls, and the only intervention was about that she should not be pregnant, that she shouldn't have gotten pregnant. This is the contraception you take once you deliver your baby, which is important, and we need to prevent unwanted pregnancy. But that's not high quality care for pregnancy. High quality care for pregnancy is ensuring she has breastfeeding support, pregnancy support, delivery support, not just talking to her like she's a problem. So certain biases we have to think about and change, and we likely have the same biases towards menstrual hygiene care, SRH provision, and also biases with how we engage with boys. Are we teaching adolescent boys about menstrual hygiene? Have they got a greater awareness of SRH? Because in many of these cases of health, it really needs the support of, like I said, the individual, her family, and the community as well. Then the next point is, what does it mean for developing suitable evidence that enables the provision of high quality care? One thing that we need is local scholarship. With that dynamic social context to health, you really can't take a study from the US or the UK and adapt it to another place in the world. We really need to develop strong research locally that understands the dynamics of the lives of adolescents. Finally, we want healthy adolescents, but also adolescents who have developed a healthy, empowered identity. And this identity will carry on with them throughout the rest of their lives. This is empowered identity physically, mentally, socially, and spiritually. And this serves as the foundation for health throughout womanhood. So I want to go back to one of my first slides to think of adolescent health as a foundation for future health that has triple dividends. I want to thank you for having me to talk, and I look forward to your questions at the end of this wonderful seminar. Thank you very much.
Muchísimas gracias.
Thank you so much, Dr. Parnas. Thank you for your excellent presentation. You have shown us the characteristics of this stage of adolescence, where you've mentioned that this is the proper time where major changes occur, and that there are some risks that can occur, such as the inadequate use of substances, and there is with these things start also in terms of nutrition. And there's a high likelihood for injury and violence, mental disorders, infectious diseases, physical chronic conditions. and the rights for reproductive and sexual health. See it not as a risk, but as an opportunity. So states can generate policies to work this way, and there should be a good quality health care, health for everyone with no difference in terms of age, gender, race, or other. You've shown a study with the Lancet where we need evidence in terms of this care to have healthy adolescents, physically, spiritually, thinking in their future. So when she becomes a woman. Dr. Farnas, thank you so much. Very special thanks, because you know that this is very early morning for you. So we would like you to invite a few more minutes more with us in the room, so for the Q&A from the audience. Thank you so much. Next, to address the health and wellness of the adult women, we welcome Dr. Diana Torrecilla. Dr. Torrecilla is a medical auditor with a solid professional experience of 12 years in the field of occupational health. She has a master's degree in occupational health and environment. During her career, she has developed and perfected skills to contribute to business success. Her experience includes the strategic elaboration of the annual occupational health plan and program, as well as the effective implementation of procedures for integrated management systems. It has successfully led the management of training, occupational medical exams, occupational medical surveillance, and the proactive identification, mitigation of occupational health risks. This proactive and preventive approach has resulted in safer, more productive, and profitable work environment. Welcome, Dr. Diana Torrecilla. Go ahead with your presentation. You have the floor. Very kind for your introduction. Thank you. Today, we're going to talk about something very important, which is women during their adulthood, considering that age, according to WHO, is starting on 20 to 59 years. And it is important that we take into consideration important topics such as the major cases of mortality. We know that the leading cause of mortality in adult women in this age group is breast cancer. However, something that we sometimes overlook is that cardiovascular diseases are also the main cause of death in women, because 31% worldwide are cardiovascular diseases, and it is said that more than 50% are in women. It is important that we take this into consideration, because we have to give more importance to cardiovascular diseases, where we also have overweight, obesity, physical inactivity, as in the case of the pandemic, where many of us have been doing very little physical activity with remote work and other type of activities. Today, women in their adulthood, we are mostly people who work and carry other activities in the home. So we need to consider that by having some associated conditions to us can also generate these cardiovascular issues such as diabetes, hypertension, hypercholesterolemia or dyslipidemias, and the use of smoking that has a negative influence, and this may lead us to peace. We have seen that in the world, precordial or chest pain or some type of signs in women, according to what we have evaluated, 36% of women identify chest pain as a sign of an MI. We do not recognize that we have some cardiovascular issue, and when we go to seek care, is very unlikely that there is no a good clinical story or good clinical evaluation. We will not suspect that this woman is having some sign or symptom of MI. Physicians usually associated this pain as to stress or muscle pain, overwork, but there's not good medical history in diagnosis. We won't suspect that they may suffer cardiovascular diseases. And many of us perhaps do not know that this is one of the major causes of death in women. At the gynecological level, we as women have some disorders, such as menstrual irregularity that increases with age, the urinary incontinence that occurs with age because the muscles may also lose their elasticity and may lose their function, and this results in pelvic floor disorders. We're also exposed to some pH changes, and that results in some issues, and we have higher rate of infections either if we don't have adequate care. So we have always to insist that we should do a gynecological annual exam for early identification of any disorder. When we go a little further, we need to also consider fertility because into WHO, women from 15 to 45 years of age are considered that they can be fertile, and we have to insist in a regular exam to rule out any issues such as uterine fibroma, polycystic ovaries, some endometriosis, or early ovaric failure that may perhaps affect the women's fertility. It is also important before using any contraception, in the case of women, that they must want to have some preventive care during some part of their life cycle. We also have to consider that part of the well-being is not only physical but also mental. We as women have been more propense to not violence, not only physical but also psychological, and this can also impact in our health. And considering that in Peru, the percentage has increased to 12.2% of cases of feminicide in 2023, and at the Latin American and the Caribbean level, we have 4,598 cases. This is very surprising because we are more exposed to violence. The fact that this happens to us, this can result in depression and an increase in suicide rate that has increased dramatically. So the emotional part has also a lot to do. Here there's also an influence of menopause because women around the age of 50 can have some hormonal disorders, and that makes us more susceptible to have more sensitive emotions, be more susceptible. We may fall into depression if we don't have an adequate or early treatment and diagnosis and treatment. Therefore, we have to insist in effective health. Effective health, as the previous colleagues mentioned, starts from there little. Since we are little, we need to have emotional stability, where the parents have to influence us in our self-esteem and safety, so we can realize of what quality of love we can receive and we can give, following certain models that can help us to be stronger. Therefore, it is important to insist in self-care, not only at the physical level, but also on the personal and emotional level, because this is going to contribute at this stage in a positive or negative way, and it's going to be able to help us to grow as women, thrive as women that have the same capacity of professional development and that can have this autonomy. So that by having empathy and solidarity, that is characteristic in most women, this is going to help us to have more qualities that can have a positive influence in our affective health. In the reproductive area, we also need to talk about the importance of sexual health, because we have the right to our body, the right to intimacy without going against our privacy. We as women are exposed to violate our intimacy, not only in the workplace, but also around our home. No violence, without violence or diseases, and to live in a dignified manner. We have many rights in terms of the workplace, and this is going to help us becoming stronger. For example, in Peru, we have laws that protect women, the pregnant women, and the lactating mother, so that women can have a time leave for pregnancy or breastfeeding. In terms of pregnancy, we need to know that prenatal control is very important. The first trimester, we need to do some lab tests, HIV, syphilis, to rule out any disease, and ultrasound that's recommended between 11 and 13 weeks, so we can detect any pathology or chromosomal disorder. And in the second trimester, we also have prenatal control and consider that from 20 weeks, we can insist in vaccination. Vaccination is very important, not only of influenza and hepatitis B, but DP. In the third trimester, we have to insist in prenatal, more continuous prenatal control and its early sign, and identify the early signs of alarm that can help us to prevent any emergency. We also need to take into account that in Peru, there is a law that establishes that there is maternity leave. This maternity leave, 90 days, and we can take it 45 days before delivery and 45 days after delivery, that are going to allow us to recover both physically and emotionally, and in that way, we can strengthen our bond with our baby. We also need to consider that at this stage, I would like to comment about the pregnancy and lactating law, because we have the right to be in an area that doesn't expose us while we are pregnant to any physical, biological, or chemical risk that may expose or go against an adequate gestation development. We also have to consider the postmenopausal, where there's no reproductive stage, where perhaps we're no longer fertile or pregnancy, we need to consider that we need to continue going to see the physician every year. We need our medical controls with PAP, with echography, and to prevent osteoporosis. That also is going to help us in the cardiovascular area, because 1 out of 3 women has overweight or obesity issues, which influences negatively in cardiovascular risk that we may have. It is also important that any change that we have can be talked to our partner, because women are subject to hormonal changes, and therefore these changes in the mood, in the character, and we perhaps may be more susceptible sometimes. And it is important that our partner knows about that, because they can know how we feel. Therefore, communication must be as more effective and clear possible. So in that way, we can maintain a healthy relationship at a stage that is very important for women, where there are many physiological changes, and therefore this may lead us to sudden changes in mood. So as we see, we are looking at the different stages of adulthood, where we've seen women at more advanced the age, there are larger physiological changes, considering that as starting at the age of 41, we can have premenopausal issues, and at 51 years of age, with other types of changes, such as facial acuity, loss of muscle mass, perhaps a decrease in balance, or have some gynecological disorder. Therefore, we always need to have annual control for prevention, because we have to prevent any breast or cervical cancer. And at this stage, it's important to remember that any disease treated on time may lead us to a successful cure. So in the case of pregnant women, in Peru, we have a law that I just mentioned that is the 26/4, where we established 90 days of maternity leave, and the law of pregnant and lactating women, that's law 28048, that according to the type of work that we have, the employer has to relocate the person if they are putting her at risk on their pregnancy or may generate any fetal disorder. And we also, in the case of lactating women, we have the right to use a lactarium, where you can guarantee the right to intimacy and privacy, so we can leave the breast milk and have the space to use for us as women. This is mandatory, with 20 women in age of women's in age of can become pregnant and or can be lactating. They have to have a special place designed for this. And we also need to consider that we have a law that prevents violence against women, because we not always treated with the same quality, and sometimes the working positions may be more towards the males, but we need to know that we have the right to work with equal work and the same opportunities, because we are adequately qualified for promotion and have the same salary that a male can have. At present, we are more propense to develop professionally, and it's important for us to empower and have professional love and care, and we can do it. Another things that are recommended as general recommendations in the case of women is to have healthy habits, the ABC of our care due to the risk that we are exposed. Nutrition is important, physical activity is important, well-being, both physical as and emotional, take care of us and prevent any risk and aggressions, and to report it. Remember that there is a committee in all the businesses for labor harassment, and to enjoy any step of our life. We need to remember at every stage of our lives, the magical and unique step. Yesterday is past, we need to live today and enjoy of everything that happens to us, because we are very important and we are people that can thrive and somehow have a positive impact on society, and we can also achieve any dream that we. I thank you very much for your attention.
Muchísimas gracias, doctora.
Thank you very much, doctor.
Agradecemos mucho
We
su excelente
thank you
presentación.
for your excellent presentation.
Nos ha mostrado la etapa
You have shown
de la mujer adulta, las características
the stages of the adult women. You mentioned to what they are exposed, such as cardiovascular diseases, gynecological disorders related to fertility, affective sexual health. You've spoken about vaccines required for pregnancy, postmenopausal state, and you have reminded us that the first cause of death is breast cancer, but we also need to take into consideration that cardiovascular diseases are also important, because 1% worldwide, more than half, 56%, are in women. And sometimes we do not know about, we don't consider this when women come to the emergency room with a chest pain. And we also have a recommendation to, in terms of nutrition and physical activity, that we know, but we will continue insisting, of course, take care of the risk and enjoy of each stage, and consider that each moment that we spend in our lives has its own characteristics and needs, and a very specific care. Thank you so much, Dr. Torrecilla, and please we invite you to remain in the room. At the end, we will have a dialogue based on the questions left by the audience. Thank you. Now, to address health and wellness of the elderly women, we welcome Dr. Veronica Gonzalez. Dr. Gonzalez is a medical doctor graduated from the Universidad Nacional Mayor de San Marcos, specialist in geriatrics and master in gerontology from the Universidad Nacional Federico Villarreal. She has a master's degree in palliative care and pain management by the San Marcos University, PhD in public health by Federico Villarreal National University, and a diploma in nutrition from the university, from Stanford University. She is a past president of the Peruvian Society of Gerontology and Geriatrics. She has been a member of the advisory committee of COMLAT. This is the Latin American Committee of Gerontology and Geriatrics. Member of the Latin American Academy of Medicine of the Elderly. Member of the Peruvian Society of Palliative Care. Advisor of research work in the field of older adults. Welcome, Dr. Veronica González. Go ahead with your presentation.
Muchas gracias a la otra María del Carmen.
Thank you,
por
Dr.
su
Calle,
invitación.
and to
Muy
you for the
amable.
invitation to participate in
¿Me
this
pueden
webinar.
¿Sí?
Can you hear me? Yes, we
Sí,
can.
sí, sí, lo
Es un
escuchamos.
gusto para mí estar con
It's
ustedes
a
en
pleasure for me to be
webinar
with you
y poder hablar
in
de
this
lo que me
webinar
apasiona,
and to talk about my
adultos
passion,
mayores, ¿no? Que es
the
lo que
elderly,
día con día.
which is what
Y
I
en
do
esta
every day.
oportunidad
And
vamos
in
a
this
hablar
opportunity,
sobre
we're
la
going to
salud y
talk
bienestar de
about
nuestros
health and
adultos durante
well-being
la vida
of women through their
en
course
la
of life
etapa de la adultez mayor.
y,
Y para
during
comenzar,
the
queremos hablar
elderly
un
stage. And
poco
to begin, I'm going
más
to
que
focus
nada en la
in
parte social.
the social
¿Qué
part.
pasa con nuestros adultos
What happens
mayores?
with
¿Qué
our
pasa
elderly
con estas
women?
personas
What
que están
happens with these
envejeciendo,
people that are
que no
aging
tienen un
and who
sustento
don't
sobre
have
cómo ir adelante
how to
en su
move
vida? Porque
ahead
no
in their
tienen
life
recursos. Y esa es una
because they don't
realidad
have any
que tenemos
resource?
en toda América
And this is
Latina.
a reality in Latin America
Porque hay una inequidad de
because
género,
there's a
porque
gender
los
inequality,
hombres han trabajado más que las
because
mujeres,
men have worked
porque
more than women,
como
because,
han dicho mis predecesoras,
as
han
my
tenido
predecessors
mejor
mentioned, they have
remuneración, quizás
access
al
to
mismo nivel
better
que la mujer, y
salary,
han
making the same
trabajado.
work
Las mujeres no
as women,
trabajaban.
and that
En este milenio y en el
in,
anterior, a partir
in
de
the
mi
previous
corta
years,
edad,
women didn't
solamente las
work,
mujeres
but
han
in this
trabajado.
last
Y al comenzar los
millennium, women
1900,
are
las
working.
mujeres más permanecían
But
en casa.
starting in
En el caso de
1900,
todavía
women
tenemos
used to
en
stay
nuestra
at home.
población a unas adultas
So
mayores
we
que
still
nunca
have
trabajaron.
elderly
Muchas
women
de
who
ellas
have never
trabajaron,
worked.
pero
Many of them
otras
have
no.
worked, but others
Y por
who
ende,
don't.
pues
And
quienes no
therefore,
trabajaron
if they haven't worked
de forma regular, pues no
on
tienen
a
acceso
regular
a
basis,
una
they don't have
jubilación.
access to a retirement
Tenemos en
plan.
nuestras latitudes, en toda América Latina,
In Latin
y
America, in
sobre todo
our
en el
countries,
país que nos ocupa,
especially
que es Perú,
in Peru,
hay muy pobre cultura
there's a
previsional.
poor
¿Y a qué me refiero con esto? Que las
prevention
personas que
culture.
trabajan,
So
pues
people who
son de
work
forma, digamos,
do
lo
it,
hacen de forma no de forma,
they do it in a,
digamos, atentas a un sueldo, sino lo hacen de forma
they
irregular,
don't receive a
de
regular
forma
salary.
informal,
They do
y
it
por
in
lo
an
tanto no tienen
informal way,
acceso
and
a
therefore
algún
they
plan de
have
jubilación.
access to a
La
retirement
Organización
plan.
Económica para la América Latina, que es
The
la CEPAL, que es una de las 5
ECLAC,
comisiones de la UNE que
which is
mide
one
el
of the
desarrollo
5
de las personas en
UN
forma
commissions that have
informal,
to do with
pues ha hecho una
countries'
serie de
economic development,
indicadores y de exposiciones en las cuales
has
se
made
ve
several
que en la
presentations
realidad
which
tenemos y
we
poca
see the
igualdad de
reality,
sociedad, sobre todo aquí
and
en
there's
América
a
Latina.
large inequality in Latin America.
En América Latina tenemos que el bienestar
In
de
Latin
las
America,
personas en
we
edad
have
baja
the
depende
well-being of
mucho
the elderly
de
depend
cómo está este sistema de
mostly
pensiones. Y
on the
lamentablemente en
pension
Perú,
system. And
en
unfortunately, in
solo de
Peru,
cada 3 personas que trabajan, pues de cada 10 personas que trabajan,
of
solo 3 van
10
a tener
people who
acceso
work, only 3 have
a
access
una
to
pensión de jubilación.
a
Y las
retirement
pensiones de
fund.
jubilación son muy
And
pobres,
the
son
retirement funds
incluso de
are
bajo
quite
escala familiar.
limited. In the
No
lower
llegan
portion of the
a
screen,
más
you
o
can
menos el punto
see
medio de los cobros de jubilación. Y decimos
the
pues que mientras
retirement funds that while
hay algunos países que bordean los
some
$500
countries are
$600
close
en
to
la pensión
$500
de
in Latin
adultos,
America,
llegan
some
a
other
países
country
como Venezuela
hardly
a
make
cobrar
to $6
$156
like Venezuela,
$156 como es en Argentina, en
$156
Perú
in
otros,
Argentina,
como en Perú, que están alrededor de los
and others
208
such as Peru that
en cuanto
are
a lo que es una pensión de
with
jubilación. Pero esas cifras no
$267,
alcanzan
which
para
really is not enough
configurar una
to
canasta familiar.
cover
Imagínense
a family
si tenemos
basket.
un adulto mayor que
And
tiene
if
que
we
pagar
have an
todas
elderly that needs to pay
su
for
comida,
all
la
their
casa,
food,
que no tiene una casa propia,
the
pues sus
rent,
necesidades de su salud
and other needs,
no tiene
health,
realmente cómo cubrirse solo con
they
la
don't
pensión
cannot
de jubilación.
cover.
Felizmente que en América Latina
Fortunately,
todavía
in
tenemos la
Latin
costumbre
America, we
de
still have
tener
the
con nosotros
culture
a nuestros adultos
of
mayores en
having
nuestro
with
hogar
us
y
an
al tener
elderly
una
at
pensión
home,
familiar, la mayor parte de ellos,
and
pues
they
no
live
la
with
cobran.
us. So
Esto hace que de alguna manera
this makes it
ese
somehow
panorama que tenemos con respecto a lo que es
the
la transparencia
situation in terms of
y lo que
retirement
son
funds
los manejos de estos fondos, pues
and how these funds are
queda de
managed
alguna manera
is
como
somehow
que sopesado, ¿no? Por el apoyo familiar.
compensated with
Tenemos, como
family
mencionaba
support.
hace un rato, que cada país determina una cantidad de sus fondos
We
hacia
know that
pensiones.
each country
En América
allocates
Latina
their
realmente lo que
pension
pasa
fund,
con
and
la
in Latin
pensión de
America,
adultos es pobre. Y
that
cuando
for the
vemos
elderly is quite
las
limited.
personas que reciben un
And of
salario
people who receive a
de
salary,
jubilación
a retirement
en América Latina,
salary,
pues no hay una
in
equidad
Latin
entre hombres y
America,
mujeres,
there's
¿no?
no
No hay mayor equidad, por
equity
ejemplo, en
between
Ecuador
men
es
and women.
0,11 a 1,
There's more
0,62 más o
in
menos,
Ecuador of
mientras que en otros
0.72,
países como
while in other
Venezuela,
countries
El
such as
Salvador y Argentina
Venezuela,
está pues
Colombia,
muy por
Peru,
debajo
it's
lo
quite
que recibe la
limited
mujer en relación a lo que recibe
or
un
what the
hombre con
women
su retirada.
receive
Por
compared
lo
to
tanto, es
a
importante
man
saber,
who's
primero, que
retired.
la
It's important to know that women's work was not regular, was not constant, was not formal, and therefore there hasn't been a culture for retirement. And their pension fund is smaller for women than for men.
y hacia nuestra población objetivo con este tema de
When we're talking
de la cultura previsional.
this
Tenemos
for
también
retirement,
que cuando
we
estamos en
also
este
have
grupo
that
etario
when we are
de
in this
tercera edad,
age group,
muchas de las personas, si no tienen acceso a
many
una
persons,
jubilación,
if they don't have
viven
access
solas
to
porque
a
no tienen
retirement fund
familia
or live on their own
no
because they
han
don't have
tenido
any
una buena
family,
preparación para
or
esta etapa,
they
¿no?
didn't prepare themselves for this
Como digo,
stage,
viven solas, no tendrían familia,
and they live alone, no family,
no van a tener el acceso adecuado
they're
a
not going to
a
have
comida
adequate
alimentaria
access to
adecuada
clothing,
y acceso a servicios básicos, ¿no? En ese
household,
sentido,
or basic services.
en América Latina sí hay
So in
diferentes
Latin America, there are
entidades que
a
apoyan
number of entities
a los
that
adultos mayores, en general
support
a todas las
the
mujeres,
elderly, especially
en
women,
lo que son pues centros de adultos
in
mayores,
terms
centros
of
de
the
capacitación, centros de ayuda,
training center for the elderly,
que se han
support center for
desarrollado
the
en el mundo,
elderly,
¿no?
but it's not as developed as we see
Evidentemente
in
en
Europe.
América Latina no es como en Europa,
Unfortunately,
no es como en Estados Unidos,
this is the
donde
situation in
Dios
Latin
bendiga a las
America
personas
is not
acceden
like
a
the
ello,
US or
sino
Europe.
que muy poca gente tiene
Very
acceso
few
a esta
people have
seguridad
access to this type
y a
of
un sueldo, como
security
digo,
and
previsional.
salary.
Por
Only
lo
three
tanto,
out of 10, and
es
therefore
importante ayudar a que estas
it is
personas, adultos
important to
mayores,
help these
mujeres que no
elderly
tienen cómo
women
acceder a sus servicios
who
básicos,
don't
puedan
have access
tenerlo
to basic services can do
de
so
una forma más adecuada y tengan una
in a
vida
more
mejor.
adequate and have a more dignified life.
Cuando hablamos de este grupo
When we
poblacional,
talk
y lo
about
menciono
this
yo, de
population group
lo que es no tener una cultura previsional,
of
no
not
haber
having
desempleo
a
de forma
retirement
regular, sin
culture
acceso
or a
y
regular
donde estas
employment,
personas
that these people
han trabajado como han podido,
are
llegan a la adultez
working
mayor,
and
en el Perú es a partir de los
become
60 años,
elderly
y
at the age of 60 in
en
Peru.
otras latitudes 65, tenemos una adulta mayor que ha
We have
envejecido
an
pobre,
elderly that has
que no ha tenido
become
un empleo
elderly being poor
formal,
with no formal
y hace el
employment.
resto de los años, si es que ha estado trabajando de una
And if
forma
she
regular,
has been
no
working on
tiene
a regular
cómo
basis,
sostener a su familia,
she doesn't have
no
to
tiene cómo
sustain their
sostenerse
family
porque ya
or
sus
sustain
años,
herself
y voy a abordar un
because
poquito después el tema de la salud,
their
de cómo ha
age
cambiado su cuerpo,
and the
para
changes in
poder
their body,
enfrentar algunos
she would not
trabajos que
be
ya
able to
necesita,
deal
como por
with some
ejemplo
work that
podría
she
ser el
did
carbón,
before.
y
She
ahora
was a
ya no es trabajador de obra
high-end
y deja coser como antes, pues no tiene cómo valerse o
clothing
no puede insertar una aguja. Y así
manufacturer
las
and cannot
manos lindas y fuertes
sew
que ya ni los médicos
or
tienen,
work
pues ya le ayudan.
because of the limited
Entonces,
vision.
el tener
So
estas dificultades de no poder
having
hacer lo
these
que ya tiene,
limitations,
hace
not
que
doing what she
necesitemos
has
de
been doing,
capacitación para que este grupo
there
ya
are
a los
some
60 años
training
pueda de alguna forma autovalerse.
systems that
Por
can
ejemplo, que
provide
puedan
them
emprender
some more
con una pequeña
training,
panadería, una pequeña
or they
tienda,
can open a
quizás,
small
o como
shop
digo,
or
ya hay grupos
store
también que
or
ayudan a
work with
educar a las personas adultas mayores
photocopies
para que
or
puedan
printing.
gestionar sus
And there are
recursos.
some programs that can
La
help them
peruana
manage the
o la mujer
resources.
peruana es muy habilidosa
Peruvian
y
women
las
is very
mamás y las
skillful,
abuelas hasta se
and
pueden hacer
mothers
maravillosas
and
con esto
grandmothers can
de
even
tener
make
cocinas
ice
para
cream
poder tener algún
or
recurso en la
jello
casa.
to have some
Pero hay
income.
formas en las cuales
But there are
pueden hacer un
ways
poco más
which
de
she
esta
can
forma
earn more,
y hacen emprendimientos. ¿Cuántas
and this
mujeres
is with
valorosas,
enterprises.
aguerridas hay
Many
que aprendieron a hacer postres
brave women
para
learn to
hacer
do
su
things,
emporio
and they
de
start
postres
with their
artesanos a
own
nivel de
company
todo Lima y luego a
and
nivel del Perú?
grew at
Y hay
the
muchos ejemplos, ¿no? Que
city
alguien aprendió de
level and
una
then
señora
expanded to
empleada
Peru.
del
There
hogar
are
que
there are
hacía
many
decoración
examples of this.
y que su
Women
patrón
like
ayudó a esta
cooking,
señora
and
a
she
hacerle
started
una
cooking
pequeña
at home,
demostración
and
y
she
un día
started
comenzó a vender aquí para todo el mundo.
selling this
Entonces,
food to
realmente hay
many others.
formas en las
So
cuales
there are
esta
ways
adulta mayor
that the elderly
ha tenido, si ya no
women
puede hacer lo que hacía antes,
can no
pues
longer do
poder
what she
trabajar.
did
Y hay,
before,
hay
can
sistemas que les
work
ayudan a
and
que
earn
esto se
money,
modifique y
and there are
puedan hacer
systems that can train them
eventualmente a una labor que
and
no hacía previamente, ¿no?
do something that
¿Cuántas
she
mujeres
didn't
hay
do
vendiendo
before.
chocolates, haciendo mazamorra, haciendo
Many women doing different
brownies para otros, que
desserts
siempre
or
ven la manera de sacar adelante a su familia y ayudan a sus nietos,
trying to
ayudan a
help
sus
their
hijos
family
de
and
esa
help their
forma.
own kids, their own
La
children.
mujer que sacó adelante a su familia
And these
encuentra la
women
forma
still works and
en
finds
redes
a
sociales
way
de seguir ayudando y
of
creciendo.
continue
Las
helping
mujeres
and
hoy ya
growing.
dominan la internet, pueden navegar en la red
Women can
y
now
pueden
use the internet, surf
comunicarse
the
con sus
web,
hijos, con sus
and communicate with their children and grandchildren.
Poco a poco,
They have learned how to use the
tienen mejores
internet,
teléfonos celulares que los varones.
and they understand cell
Es una
phones
realidad,
use.
una realidad. Entonces
That
tenemos
is a
muchas adultas
reality.
mayores
So these
emprendedoras
elderly women
están
who are beautiful
tan empoderadas que han
are
ido
so
y
empowered
no se quedan de hambre,
that they
porque
don't
buscan la forma
stay
de
behind because they
salir adelante,
find a
de
way
surgir con lo que saben
to
y con lo que no saben, porque las que más
work,
asisten a los clubes de adultos mayores son las adultas mayores, las mujeres,
and
aprenden de costura, de
they can
tejer, de
learn
cosmética
from
y venden
different
sus cosas
activities and
de
sell
forma
the
linda
products
en las plazas. Cuando hay
in the
ventas en plazas, también las
squares and
mujeres,
in
no
the
las mujeres,
street
porque somos emprendedoras, porque ellas son emprendedoras
because they are
y porque siempre sacaron a su
entrepreneurs
familia adelante.
and they always
Entonces,
were
hay
important
capacitaciones que
in
buscan tanto a
making
varones como a
ends
mujeres.
meet in their
Hay la
families.
Universidad de la Tercera Edad que también da
There's
cursos para
the
que podamos
University
hacer
for the
nuestros
elderly that
propios
offer courses in
negocios
terms of
propios, como por ejemplo
businesses
Mije, hacer
or
la tiendita, la
to
pequeña
have
librería,
a
el
small
almacencito, la
store.
copiadora, para
We
que
offer
podamos
photocopy machine so
autosustentarnos.
they can
Y hay también incluso
help
formas en que
themselves.
podemos
And there are
utilizar
ways
nuestro dinero,
that we can use,
utilizar nuestro dinero para
teach them
poder
how to administer their
crecer y
money
poder
to
desarrollarnos y
continue
poder
growing
salir
and
adelante y ayudar a
thrive
nuestra familia. No solo ellas solas.
and help their
Si
families.
están solas lo hacen y si no también
They
con
can do
algún
it alone
esposo,
or they can do it
¿no?
helping
Entonces es
their family.
importante
So it
que
is important.
si hemos trabajado, ya no podemos trabajar en lo mismo que trabajamos
We can
antes,
no longer working
haya
what
un
we used to
manejo
work before.
prejubilatorio y si somos
There's
hijos
some
normales también chance para
pre-retirement
poder hacer
training
algo en lo cual podamos subir
in
más
order
adelante
to
y
do
obviamente
something in
también
the
la Universidad de la
future.
Tercera Edad que va a ayudar a que estas personas
And this is going to help
adultas mayores que no tienen
elderly
una
women
pensión
who don't
puedan
receive a pension
sobrevivir y por qué no
and
vivir de
survive
forma digna.
and live
Entonces,
in
hay
a
miles de actividades
dignified manner.
y hay muchos clubes, muchos
So
centros
there are
adultos
many
mayores
clubs
en
and
muchas municipalidades en todo el
elderly
país que
centers
en del
throughout the
90%
country.
muchas adultas mayores tratan de salir adelante, ¿no?
So
Porque como les
for
digo, en
them,
América Latina
because
no todos tienen una
in
pensión de
Latin
jubilación,
America, not
también hay
all
una
have a
equidad entre el
retirement
varón y la
fund,
mujer.
and
El que
there's an
más
inequality
problemas
between
tiene
men
este
and
grupo
women.
etario es económico,
And this age
social,
group has
porque
an
el adulto mayor
economic problem,
no
social
tiene
problem,
empleo, porque
because
bueno,
the
muchas veces
elderly
necesita
doesn't
sostener su
have
casa,
a
porque el adulto
job
mayor no tiene
or has
un lugar
several
donde ir o donde
limitations,
comer,
has no place
y en
where to
muchos
live
casos, o
or
si está
eat.
solo, no tiene
And if
cómo
she's
sostenerse.
alone,
Entonces,
he
estos
doesn't.
cursos, estas capacitaciones
So
del
this training and
empoderamiento
these
de la
courses
mujer guerrera que fue ama de familia, jefa de hogar,
and the
hacen que este grupo no
attitude
sea
of this woman
estigmatizante. Por eso que debe
makes
tener
them
un poco
be
de esa parte,
successful.
sobre todo social, porque es muy, muy
I
importante.
think this
El
social
gran
part is
problema
very
de las adultas
important because the
mayores, yo
most
también
important
aporto
problem
mi
of the
granito como
elderly
psicóloga, por eso abordo tanto este punto, es social,
is
más que de
social
salud.
more than
Entonces,
health.
los adultos mayores más que
So the
geriátricos necesitan
elderly, more
gerontólogos
than
que
geriatrics, need
puedan ayudarles
gerontologists that can
con
help them to
recursos, que les
manage
puedan
their
ayudar con
resources,
su ropa, que les
help them
puedan
their
ayudar con unos
clothing,
lentes, ayudas
their
audiovisuales,
glasses, audiovisual
cómo
aids,
acceder a la web, cómo acceder
how
a
to
diferentes
access
redes
the
sociales y
internet,
puedan de alguna
different
forma
social
estar
media,
conectados con los demás
and
y
be
puedan
communicated with the
crecer y
rest
seguir
and
desarrollándose
grow and
y seguir
thrive
viviendo de forma
and
digna.
continue living in a
En esta
dignified
plática también tengo
manner.
a una señora
In
adulta
this
mayor que más de 100
IUT
años
and
que ella
elderly
también
women over the
trabajaba
age of 100,
hasta más de esa edad para
and she is working
autosustentarse, ¿no? Y hasta sus 93
self-employed.
años sigue trabajando
She
todavía.
continue working
Entonces, como
after
ustedes
the age
ven,
of
la
100. So
mujer
you can see
es emprendedora, la mujer adulta mayor lucha
the
y
elderly
sale
woman
adelante y
is
ayuda
a
a sus nietos
fighter
también.
and
¿Por qué?
helps their
Porque
grandchildren
ayuda a que hagan las tareas y
because
que
they
les
help them
enseña
with their
cosas
homework
antes, ¿no? En la parte más básica, en la parte de ayudar a
and
leer,
the
borrar y esas cosas, porque
basic
ahora los chicos están volando con sus
chores,
conocimientos, pero
helping the
siempre tienen
small
ahí a la
babies,
abuela que está al lado de ellos,
but they always have the
capacitándoles
grandmother next to
saludables,
them
acercándoles
with healthy foods
algo de su conocimiento, algo
and transmitting
de su
knowledge and
expertise,
experience
de su experiencia
and
para
their
ayudar a sus nietos.
experience to help their
Tenemos esta
grandchildren.
edad
At this
y
age,
muchas veces creemos
we
que porque ya
many
la
times
adulta
believe
mayor,
because
más de
the
60, 65
elderly
años,
is over the age of
tiene que quedarse en
70,
casa cuidando
has to
nietos, tiene
stay
que
at
quedarse en
home
casa
taking
cuidando
care of their
sobrinos, tiene que quedarse
grandchildren
cocinando
or
y
has to stay at
no
home cooking
tiene tiempo para ellas.
and they don't have time
¿Cómo
for
continúan,
themselves.
señores y señoras? Las mujeres adultas mayores ya
Well,
cumplieron
the
su
elderly
misión.
women have already
Si
made
cuidan a un nieto
their
es porque quieren cuidarlo,
impact. And
pero
if
es
they
su
want to take care of
obligación.
the grandchild, it's because they
Porque
want to
deberían
do
seguir
it. It's
viviendo
not
con
an
vivos
obligation. They
y
have the
ser
right to
papás
continue
con los
with their
nietos
life.
recién después de los
how many grandparents we see that they're starting to travel and they can no longer go on a trip. So let's not wait until they have functional limitations to have them travel or enjoy life. We need to enjoy life all the time. But at this stage, after the age of 60, 65, they have to live their sexuality, their life, and live with their partners and enjoy their friends, enjoy the club, the going out, because we women like to chat. We like to have groups getting together for coffee, and we can spend hours chatting on. So we need to give these women their space, have work raising kids, children, niece, nephews. They need their space to do what they want, spend time with their friends, travel, go to their elderly club, exercise, eat, live their life and enjoy that experience. Because life has stages. We don't stop living when we become elderly. We have a different way of living and seeing things. Perhaps we have a sexuality where we don't want penetration, but just touching, sleep together, that makes us happy. And if we have a partner, there are ways and also the use of estrogens to avoid pain. If they want to do it, why not? Because the young and elderly have sexual life, so we need to promote health at that level. First, make sure and know that there are many social and health problems in this age because of the lack of resources, and we have to live, we have to provide an adequate space. Those over the age of 60 are not just meant to take care of grandchildren. They have friends, they want to go out, they want to learn Tai Chi and learn other things, travel with their partner if they have it, or with their friends. But the elderly woman has to decide. So now let's talk about health. And in Latin America, many don't have access to Social Security. Only 3 out of 10 had access to Social Security. Therefore, there are other health systems in Peru, which is from the Ministry of Health, has a comprehensive health insurance, but doesn't have the resources to treat chronic diseases. They can receive clinical emergency care, but they don't have access to medications. In Latin America, there's a similar situation, but there are other more integrated systems, like in Argentina. But the state resources are not enough to cover, and we have an elderly woman with chronic diseases that has arthrosis, osteoarthritis. When we talk about the elderly, we talk the young ones between 60 to 75 and the old elderly between 75 and older. Some of them are dependent and require support for the daily activities. And those who are independent. So the independent persons usually doing well, but those who have some dependency, had a brain infarct or diabetes or heart failure, among others, have rheumatoid arthritis, pulmonary fibrosis. Well, people who have chronic diseases are going to have to use chronic medication and going to require more health services, while those who can take care of themselves with 1 or 2 pills a day are going to be fine. Understand that at this age, we're going to have women with comorbidities that require several drugs, and we need to be careful with the use of drugs because this can be, it's a lot of drug-drug interactions, and we need to be careful with that. Understand that osteoarthritis, hypertension are more prevalent diseases in this age group. We have osteoporosis, and this has to do with estrogens in women. So 8 out of 10 cases of osteoporosis are women, are elderly women. So we need screening studies and cover the vitamin deficiencies. So they're chronic diseases that is going to be more, have more impact in those who have physical limitations. All health systems have to offer vaccines for pneumonia, for flu, for herpes, and with good coverage for herpes zoster, because the elderly decrease their immune response, and therefore their defenses are decreased. After the age of 60, there's a decrease in nutritional immunological response, and they can get herpes zoster. So we need to work in prevention with vaccines. We need to look and see that these women, they need a mammogram because it's still prevalent, and also pap smears, and for periodical control of chronic diseases. The elderly women who has estrogenic deficiency has a propension to osteoporosis, but this lack of estrogen also impacts the urethra, loses elasticity, and there's more chance to urinary tract infections. There's a vaginal dryness that affects their sexual life. So it is important to have a clinical evaluations and receive hormonal replacement therapy, if appropriate, or lubricants without estrogens, so they can have an active sexual life. Or limitations. So this is because this is part of their life. So receive estrogens, vitamins, especially vitamin D deficiencies. They lose calcium, and they have low B12, and therefore we need to take care of them with prevention and promotion to their chronic diseases, vaccination to prevent infections, the regular checkups and hormonal replacement therapy, and periodical controls, and also vitamin supplementation, so vitamin D and B12. If we find any other pathology in addition to what I've mentioned, such as anemia with chronic renal disease or diabetes, well, we need to treat the low hemoglobin with periodic controls. So we see that social services are decreased, the access to health is restricted in Latin America. There are some countries, Uruguay, that despite their limitations, such as Argentina, has an excellent service
con
Cuba,
servicios de
Mexico
puertos,
with
latitudes como Perú,
food
como Bolivia,
services, and some
tenemos
other areas of
regiones
Peru and
también,
Bolivia with
ahora
several
Venezuela,
limitations,
que
and now
tienen
Venezuela
serios problemas de salud.
with serious health
Entonces,
problems.
este grupo hay que ver el tema de osteoporosis, el manejo de sus enfermedades crónicas, sobre
So
todo
we need to
osteoporosis,
treat their chronic diseases,
el tema de la posmenopausia, que es muy frecuente,
got the
como les hemos
postmenopausal
mencionado,
state
y el acceso a
and the
algunas
access to
vacunas que se deben tener. Hay que
vaccines.
entender que a esta edad
We
también
have to understand
los
that at
cambios
this
físicos
age,
y
there's
hormonales, las mujeres tienen
physical
mayor
and
más cantidad
hormonal
de edad en el
changes
cuerpo
with
en
increasing body
relación a las
fat,
adultas jóvenes. Por lo tanto,
and therefore
tienen menos cantidad de agua y más propensas a la
they have less
deshidratación.
water
Hemos
and more
llamado que
propense to
ustedes, cuando hace mucho
dehydration.
calor, sobre todo en nuestras
So
latitudes,
in this
hay que mejorar la hidratación, ofertar más
month
agua,
of
evitar los
summer,
picos de
we need better
hipersensibilidad a
hydration,
la orden del día. Los controles periódicos a todas las edades
periodic
son
controls at
bienvenidos.
all
Los
ages
episodios
are
convulsivos
welcome.
son muy frecuentes, sobre todo en las
Cognitive
mujeres
impairment is
mayores, las
more
necesitan cada orden
frequent.
del día. Por lo tanto, tenemos que estar
Therefore, we need to
acudiendo
be
a nuestras
alert
atenciones, a nuestros chequeos de forma
and have
regular
regular
y frecuente.
checkup.
Les he comentado también que la mujer tiene
I've
más
also
frecuencia,
comment
con más frecuencia
that women
problemas de hito. Ya
have,
nos queda muy poquito tiempo, tenemos que ir
we're
cerrando.
running out of time.
Entonces tenemos a una mujer
So we have
que
a
tiene que vivir en
woman
familia,
who has to
que
live
es la matriarca de la
in
familia, que
community.
tiene una vida
She's
con
the
su
head
pareja,
of the
que ya tiene una
family
pareja,
that
que tiene
has
vida
been
alrededor de su familia y que
life
puede
around
acompañar
their
como cualquier
family
otra pareja si así lo desea.
and can
Apapachar a los nietos, que es lo que
enjoy
preferiría
their
ella también, ser
grandchildren,
tomada en cuenta,
pampered,
estar en cada una de las
take into
actividades de su familia,
consideration, participate in
como
the
el
family
nacimiento de las nietas,
activities,
gozar del
and
cariño de
to
su
enjoy
familia
their love
y ser
from their
celebrada
family and
como
be
la matriarca
celebrated,
de
the
la
head
casa.
of the
Bien,
house.
yo esto es lo que yo quería compartir con ustedes.
And this is what I
De
wanted
verdad,
to
a esa
share
mujer ser inigualable, que
to
deja sus
you,
huellas por donde
women,
quiera que pasas,
who
esa mujer,
is
madre,
so
amiga, abuela,
important, who's a
que siempre
friend,
está ahí,
a
afectuosa,
mother,
cariñosa,
a grandmother.
y a todas
Well,
nosotras, y ahí tengo la foto con mi mamita,
congratulations on your day.
siempre
And
está
this, you can
ahí
see the
apoyándome y
picture
siempre en lugar
of
para
my
todo,
mother with
siempre para
me.
ayudar a su familia. Un abrazo a todas, muchas
Okay,
gracias.
big hug to all of you. Thank you.
Muchísimas gracias, doctora
Thank
Verónica,
you
por
so much
esta importante
for your
presentación que
wonderful
nos ha
presentation.
mostrado desde un enfoque social, que es
You
el
have
principal
shown the
problema para este
social
grupo
approach for this
de mujeres
age
mayores de
group
60 años y que
of
indudablemente pues
that
las
undoubtedly
realidades que se encuentran
with the
pues en
inequalities
esta
that we find
jubilación y de repente
in
sin
terms of
cobertura,
retirement
sin esta
fund with no coverage.
está el seguro integral de salud y está el seguro social,
Unfortunately, we
pues
have Social Security and the comprehensive
impactan en su propia salud,
health
¿no?
insurance on the
Entonces
Ministry of
es
Health,
importante
and it has an impact on their health.
abordar
It is
ese
important
lado que
to
a veces
consider that
dejamos,
side that we
dejamos de ver, ¿no? Y somos,
sometimes
como dijo
don't
aquí,
see.
medicalizados. Como dijo, ya ellas
As
han
you mentioned,
colaborado, han contribuido
they
y
have
deben
worked, they
ir
have contributed, and they must
¿no?
enjoy their
Y
life,
pensar que ellos deben tener y
and
manejar lo
they
que es
can
el
have
uso de tiempo libre, ¿no? Ya no deben tener
use of their
obligaciones
free time with no
familiares
obligations in the family
y
because
esto es
they already
importante
done their job.
entenderlo, creo que todos, y aplicarlo.
That we all need to understand.
Es importante en el acceso a lo que se refiere a salud, obviamente.
And also you mentioned the access to health
Hay polifarmacia,
with the
tienen enfermedades crónicas,
pharmacies due to
y nos ha
chronic
hecho la diferencia entre
diseases.
dependientes e independientes.
And you made the difference between those who are
Importante
independent or
recordar las
dependent.
vacunas, ¿no?
And to
Es
remember the
esencial
vaccines is also
promover la
important.
vacunación,
We promote
muy importante
vaccination,
en este grupo
which
para
is important
neumonía,
in this
gripe,
age
ahora
group, pneumonia,
herpes, ¿no?
flu,
Y COVID también,
herpes, zoster,
justo en estos
and
últimos
COVID.
tiempos, ¿no? Es importante el cuidado personal,
Personal care,
la suplementación de vitaminas,
vitamin supplementation,
muchísimo el entorno de la familia, ¿no?
the environment, the
Aspecto que
family that needs
debe ser retribuido por todos,
and
como
its love
hemos
in
hablado.
retribution of what we've been lucky to receive
Muchísimas
from them.
gracias, doctora, por su
Thank you so much,
intervención.
Doctor,
Igualmente
for your
invitamos ya
presentation, and
vamos a
we invite you
iniciar
to
ya
stay, and we're going to start
el momento de las
the
preguntas que han
Q&A.
ido llegando en gran cantidad. Vamos a ver
So
cuáles vamos a
we're going to
lograr
see which ones we're
responder.
going to respond.
Debo manifestarles que se ha recibido también
We have
muchísimas
received
felicitaciones
several
de reconocimiento a
congratulations
cada una
and
de las
greetings
presentaciones
for each one of the
y obviamente de
presentations,
parte nuestra, nuestro
and
agradecimiento a todas las
we
personas
thank all the
conectadas
people that have joined
que
us
nos acompañan semana a semana.
and that follow us week after
Precisamente
week. We have officials from the ministries of health and academic centers, social organizations, public institutions, private institutions in different countries. I'm going to mention a few: Argentina, Belize, Bolivia, Chile, Colombia, Cuba, Ecuador, Spain, US, Guatemala, Mexico, Paraguay, Panama, Peru, of course, Uruguay, and Venezuela, and the UK. Please, to start this dialogue, we will thank you to keep your video active. And as I mentioned, we have many questions that have arrived during this webinar, and we will start. And please feel free to respond. We go with the first question. What research lines and actions will be promoted to reduce the gender gap in health and well-being? Who would like to answer? Go ahead, Dr. Mesa. I think that it's very important to start working in environmental sustainability as a social determinant for health. I think that we need to start to understand and manage the language, and this is a young agenda. This is the agenda that we need to work strongly for our current generations with actions that are not giant that we can do from the health sector. If we talk about children, we know that these disposable diapers never degrade, so there needs to be some action in that regard. Or if we are going to reformulate a medication that has 30 pills and the person is going to take 26, what are they going to do with the other 4? When the literature states that when they go down the drain, the fish are affected. So there's a cycle of changes that affect us. Also the issue, what we can do from health. So I believe that a very important line is to start working and to learn more that related to climate change. Thank you, Dr. Mesa. Any other speakers would like to add anything or comment on this question? Go ahead, Dr. Farnas.
Just one thing for really engaging adolescent boys so that they learn to support women. I think this will help, especially in adolescence. So I talked about adolescent girls, but how can boys also be helped to support women?
Thank you. We have more. The drug research is focused in men well-being in general. What do we need to strengthen in order to try to level that gap with regards to women? Any comment? Regards to drug research is usually focused on men well-being. What can we do? What do we need to do? What do we need to promote to change this? Go ahead, Dr. Mesa. This is a very interesting topic with health, actions in health and drugs. what happens with MIs and how they present differently in women than in men. We need a timely identification, the classical example. But there are many other topics related to adolescence and gynecology. For example, we still talk about endometriosis, and now we start to understand that menstrual colic is a debilitating condition. That is true, that we women do not invent that pain. So endometriosis is a topic that has not been well studied. We are all here pediatricians, but those internal medicine specialists, where many things were studied in men, and now they realize that they were extrapolated to women. So we need to work it again. Work it again is important. And in boys and girls, something worth highlighting is that it's very difficult to do these research projects in children through the ethics committee. So it's something to made to protect them, but also becomes a limitation because there are not very many studies when we talk about childhood or small children or pregnant due to the ethical limitations that are real. But we need to understand of how can we overcome that limitation in order to learn how the different medications work, which is in pregnant women, in boys and girls, and people under the age of 18. In my country, this is a very complex topic in terms of the ethics committee. I wanted to make a comment. May I? Well, first of all, wonderful presentations. I won't say anything in that regard. But in regards to research, there's no gender approach in the research, not yet. Because if we talk about gender approach, from the formulation, we will have to consider some equity from the formulation of the research. Because one thing is the formulation, one thing is the execution, and then we have the implementation. So there's several levels. And this is something that I would like to mention, that in public policy, for example, there's not only violence against women, and that is the gender issue. The public policies do not necessarily have this approach that they should have. That is why we continue not diagnosing cardiovascular diseases in women, where we know that this is one of the most frequent causes of death. So I think that in research, there's done major steps. We're not going to say that doesn't have happened. There's been some major progress, but you've also mentioned drugs. But remember that research is not only drugs. Research also covers quantitative, qualitative, operational research. We have many types of research. I think this is a priority issue, and we should manage it as a. So in this public policy, have we considered this power relationship? No, we haven't, because people think that is just the topic of women. When we talk gender, we talk about a relationship, what has a negative influence, because at the end, everyone have right to a dignified life, and this implies having at least the coverage of the basic services, at least. I would not like to extend my apologies. I got excited here. I'm done. Thank you. There are many questions, but we're going to start closing because we're using the presence of Dr. Farnasus very early in Australia. How do you see the evolution of the needs of reproductive and sexual health in the course of life? What needs do you consider are not adequately considered with the government's health policies.
¿Quién se anima a comentar, por favor?
Anyone would like to
Doctora González,
answer?
adelante.
Dr. Gonzalez.
Aunque en mi población no es un tema
Well,
muy,
this is a topic
digamos que
that's
tan visto porque
not
ya tenemos una
much
población de edad
considered
avanzada,
because
sí
this is
debemos
the
profundizar
elderly
todavía que se
population.
hagan las
We
pruebas
should
de Papa Nicolau hasta
promote
cierta edad, hasta 30,
and
35
recommend
años,
the pap smear
40
to a
años en las
certain
mujeres que
age
son importantes
and
también.
mammograms that are
Y
important for
obviamente
this age
considero
group.
que todas las
And of
niñas y
course, I
adolescentes
consider that all
deben de tener
girls and
en sus
adolescents
carteras, debe de
should
incluirse mucho en el tema de vacunación
have
en las
their
adolescentes y mujeres
vaccines
de 10 a 13 años, una
updated
vacunación que están haciendo para papilomavirus
for
no humano y también
human
trabajar con
papilloma
ellas en
virus
lo que
and
es
also to
infancia
work with them
reproductiva porque
reproductive and sexual
lamentablemente
health because
las chicas están
unfortunately
saliendo del
girls
colegio
are
y están
finishing high
cambiando de
school
pareja de
and
forma
they're changing
irregular sin cuidarse de forma
partners
adecuada.
very
Entonces dependemos
constantly with
mucho
adequate
en el
care.
trabajo de
So we
educación
need
sexual,
to work in
vida
sexual
sexual,
education,
cómo
sexual
cuidar
life,
tu cuerpo,
how should I take
y
care
la
of my
niña y el niño
body.
puede hacer con él lo que
I
quiera,
own my body and I
además
can do whatever I
del
want, but I need
anticonceptivo,
to take care of it.
y
It's
también obviamente trabajar
actually,
con ellos lo que es
and
la
also to work
vacunación,
with
empezando por el tema
vaccination
del cáncer de cuello uterino,
to
que es la
prevent
prevención
cervical
importante.
cancer.
Gracias, doctora. Doctora
Thank
Torrecilla,
you,
adelante.
Dr. Torrecilla.
Muchas gracias. Teniendo en cuenta que
Gracias.
nosotros ahora,
Considering
tanto
that
los adolescentes,
both
niños y adultos,
adolescents,
tenemos
boys, girls,
mucha
and adults
cercanía con la tecnología
are
y
very close
podemos
to
nosotros mismos
technology,
investigar
and
y
we can do our own
consultarlo, es
investigation and
importante
learn.
insistir en una
It's
buena
important to
comunicación entre los
insist
padres
in
con
good
las familias,
communication between
sobre todo que
parents
están
and
en la
their
etapa
girls,
de edad fértil.
especially those who are
Creo
in
que
the
es importante lo que acaba de decir la
in the
doctora, la educación
reproductive
sexual
age.
desde pequeños,
As
con
Dr.
una
mentioned, sexual
comunicación
education
clara,
since they're
que
small with
hagan que
clear
aprendan a
communication
tener el
so
autocuidado,
they can
que sepan
have their own
qué límites
self-care
deben
and know
ellos de marcar
what are the limits they
con
have
las
to
otras
establish
personas
with
y
other
qué es
people
realmente pues un
and
amor
what
propio
will
y
be
hasta qué
the
punto nosotros podemos permitir
self-care and
que
at
nuestra
what
pareja
point we allow
vulnere
our
esa
partner
barrera,
to go
ese
against that
límite.
limit.
Entonces, considero que esa parte
So
es muy
we
importante
consider that
y
this is
también la parte de
important
prevención,
and also
¿no?
the
Hay
prevention.
mujeres que
There are
tienen o
women
han decidido pues
who have
hacer
decided
retiradas de prevención y
to
evitar los embarazos
care and
prematuros, evitar
prevent
los embarazos no deseados, ya que
unplanned
sabemos
pregnancies
hay un alto
because as we
porcentaje de
know
embarazos
there's a
no
high
deseados en
percentage
nuestro
of
país al menos,
unwanted
¿no?
pregnancies in
Y
our country.
tenemos una brecha muy
So
larga,
there's
¿no?
a big
Muchas
gap,
niñas,
many
adolescentes versus mamás
adolescent girls
mayor de
versus
40 años,
mothers over the age of
que
40,
muchas se dedican a trabajar
because
y a
many work
desarrollarse profesionalmente
and
adelante. Entonces
develop
el
from the
riesgo
professional point
estético
of view.
aumenta
So the
y
aesthetic
eso lo
risk
tenemos que ver
increases,
con un adecuado
and that has to
seguimiento y a
be
nivel laboral
looked at with adequate
informar si
follow-up. And
nosotros
at
nos
the
sentimos mal, no sentir
workplace, we
temor,
need to report if
indicar de que
we don't
tengo un
feel well
dolor, de que tengo una
and
contracción, de que de
to
repente el cólico menstrual
indicate
no me
and be
siento
able
en la
to report
capacidad de
that
poder
perhaps
asistir
this menstrual
y
colic
tener una
prevents me to
curiosidad,
go working
que eso
and
no sea un
be
tabú,
taken
no
into
tengamos miedo a decir
not
que
be afraid of
necesitamos un descanso por
saying
esa
that
razón,
we have some
porque el dolor de cada
leave
persona es
because of that
distinto
pain,
y no
because
podemos generalizar.
we cannot generalize.
Muchísimas gracias.
Thank you.
Y para cerrar este
To close
espacio de
this
preguntas, te voy a hacer
Q&A
una
space,
pregunta
there's a final question.
que nos gustaría que cada uno de ustedes
We
nos
would like
conteste
that
desde su perspectiva.
each one of you could comment from their own
¿Cómo las
perspective
normas sociales, por ejemplo,
how
los
that
estándares de
social
belleza,
norms, for
la
example,
sobreexigencia de responsabilidades de la madre,
the mother's
continúan afectando la salud de las
responsibility
mujeres?
continue to affect
¿Qué
women's health?
estrategias proponen
What
para el
strategy do
empoderamiento de
you
las
propose
mujeres,
for
sobre
women's
todo para
empowerment,
incrementar una
especially
autoestima
to promote
alta y
high
una autoimagen
self-esteem
positiva?
and positive
Por favor,
self-image? Please,
doctora Mesa, adelante.
Dr. Mesa,
Empecemos como en orden.
we will start
El
in
tema
this
de
order.
los dobles y los triples roles de las
All
mujeres
the double and
es
triple roles of
terrible.
women
Nos
is,
tocó vivir una generación,
is very
felizmente, de cambio, de
significant.
empoderamiento de la
Perhaps
mujer,
there's been a
de
change in
empoderamiento en
empowerment
nuestro poder
women
tener
with our
control de
generation,
decisiones, de
understanding empowerment
participación y de
in
toma de decisión,
decision
que
making
creo que
and
es
participation.
fundamental y que hoy
This is
precisamente
extremely important
desafortunadamente estamos
today.
en esa
We
conmemoración y
are
celebrando
celebrating
muchos
that.
años además. ¿Y cómo podría
And
como
how can we continue in balancing the responsibilities that we have as women, both as professionals or technicians in the labor area, but also we continue with the responsibilities of the home. I think that is extremely important complement to the others, the joint work of women and men, because we empower a woman, we can generate violence issues if the man doesn't know about that. So it's a culture issue, and we Latin men and women have much patriarchal, machistas cultures for so many years. So the invitation here is that from the early infancy, boys and girls get the education and the adequate information, and once they have that, also have access to make their own decisions. They may know a lot of contraceptive methods, but they come to the health service and they don't have it there, or there barriers to their contraception. They live in a small town, and there's only one drugstore where the person in charge is the best friend of the father. So the mechanisms that the state has as a responsibility should be absolutely clear and transparent, so they can have access not only to methods, but to any other thing related to their rights, not only reproductive and sexual, labor rights, dignified life rights. We don't talk about early marriages or forced marriages where women, girls become slaves because they are suffering the abuse of this older person, or that the girls that want to blame because they don't take care of themselves. And this is a joint decision, and the coercion of girls with low self-esteem issues that may influence in their capacity to say no. Today I don't want, it's very complex. So we've made progress, a lot of progress, and in health and gender, there are very wonderful books about all the progress being made, but we go back to inequalities. There are population groups that have considered these topics and others with major gaps and problems. Thank you, Dr. Mesa. Dr. Farnas, we would like you.
Oh, thank you. This is a very big question. I just wanted to say that firstly, men cannot be their full potential unless women get their full rights. So this will always be the case. So I think a few things I wanted to say for adolescents is solidarity, being with other women, having other women support them so that they can work together as a team, and then also working with boys and thinking together with boys what type of parents they want to become, both of them, not just the girl, to think about what type of mother she wants to become. What type of father does the boy want to become? And like I said, identity is formed at this age. So it's a really good age to start these conversations with young people about change. And they're the quickest to change in our society. So I have hope. And I'm sure we're going to see progress. Thank you very much.
Thank you, Dr. Farnas, Dr. Correcia. Thank you. In the case of women who are adults, and most of them are working exposed to some risks, such as the right to intimacy, we could try to strengthen the self-esteem. I consider that by having a good self-esteem and identify that perhaps we need to strengthen it, this can help us to say no, as Dr. Maria Luisa mentioned. Establish limits boundaries. And since small, we need to take this into consideration. If women don't know how to identify what are our boundaries, what's right and what is wrong, we won't be able to feel well with ourselves. So that is a very important part. Not feel superior to men, but we can work as a team, work with equity, and also communicate with your partner. A good communication may avoid any type of conflict inside the home and also with the family. At the team level, we always have to work with solidarity and empathy among women and support ourselves and raise our voice when something is not, we find something is not fair and not be afraid. That's basically my answer. Thank you, Dr. Gonzalez.
Vemos que en nuestras sociedades todavía en América Latina,
Well, in Latin
como dijo
America,
la doctora María
as
Lucía,
Dr. Maria Lucia mentioned,
que somos una sociedad todavía en
we are
muchos
still
rasgos machista.
a
De hecho,
society
nuestras
that is
autonomías
machista.
todavía en muchos
So the
casos
elderly
son para los
adults
varones.
depend on
Y
males
creen que tienen que ser sumisas
and
toda
they
la
think
vida.
that
Esto
they
no es
need to
así.
be
Pero
under
yo
them
veo
all the
con
time. But
frecuencia que
I
están
frequently
interviniendo
see
para
that those
empoderar a
who
estos
are
adultos
intervening to
mayores
empower
que
these
son los
elderly
hijos y
women
los nietos.
are the
Estamos
children, their
llegando a que este quiebre,
offsprings and
esta
their
inequidad se vaya
grandchildren, helping
cogiendo un
that this
equilibrio. Por ejemplo,
inequality
decir, ¿sabes
is
qué?
more
Abuelita, te
balanced
toca salir conmigo
and say,
y anda con tu
now
mamá.
it's your turn
Y a
to
veces
come
los
with
abuelos no
me.
quieren dejarlas,
Sometimes
¿no?
the
Porque ellos en
grandfathers don't
realidad
want to leave the
ya
grandmother
los
out,
hijos y los
go
nietos
out.
están interviniendo.
So children
Y
and
comienzan a darse
grandchildren are
cuenta de que tienen ese
helping,
poder y
and
que tienen
now
que
they're
formar
starting to
parte de
realize
estos
that they
planes
have power
integrales, ¿no? Y
and
nosotros,
things
nuestra
need to be
labor,
more balanced. And
yo
our
siempre les enseño a mis hijos, porque
effort,
tengo puros hijos
and I
varones,
always tell my
varones,
children,
les
they're all
enseño
men,
con el
I
ejemplo
teach them
que
with the
tienen que
example that
respetar
you always need to
y
respect
siempre
and always
tratan con respeto a sus padres,
treat
¿no?
with
Entonces,
respect,
es
treat your
educar a
parents
los
with
hijos con el
respect,
respeto,
to
con la
educate them
igualdad de
to
equidad,
respect
va a
and
hacer que
with
puedan a
quality and
futuro
equity,
hacer de que estas
so they
sociedades
can in
sean
the
pues
future make a
más justas, ¿no?
society
Como queremos
more
nosotros en realidad.
balanced as we want, we really want.
Muchísimas gracias.
Thank you.
Para cerrar ya este
To
espacio de
close
preguntas
the
y
space of
respuestas,
Q&A,
pedirles a cada
I'm
uno
going
de
to ask
ustedes,
each one of
en este
you
orden que hemos tenido de
in the same
presentación,
order
un
of
mensaje final
presentation for a
de un
final
minuto.
message of
Adelante.
1 minute.
Doctora Mesa, por favor.
Dr.
Claro que
Mesa,
sí. Yo quisiera dejar un
I
mensaje
would like to leave a
de la
message about
importancia de
the
recordar y
importance
tomar nuestras
of
decisiones alrededor
making
de
our
los derechos de
decisions
las niñas y los
around the
adolescentes.
rights of boys, girls, and
El interés
adolescents.
superior del niño es uno de sus
The
principios
superior interest
fundamentales,
of
el
the
derecho a la
child is
vida, el
one of the
derecho al
fundamental rights,
desarrollo,
that's the
la
right to life, to
participación,
develop,
tener en cuenta sus
to
opiniones
consider
personales.
their
Nos
opinions,
ayuda
hear their
muchísimo
voice.
la
That
perspectiva
helps
de
us
derechos
to
a
have
tomar las
the
mejores
perspective to
decisiones.
make
Entonces,
the best
ahí esa
decisions.
invitación.
I would do that invitation. Thank you.
I just want to just shout out to solidarity from Australia to Latin America to everywhere, that women stand together and that we're working to make a healthier, dignified society. And I'm very proud to be standing here with you all today.
Doctora Torrecilla, por favor.
Dr. Torrecilla, your final message. Thank you. We need to support girls since they're little. Try to educate boys and girls the same. It's okay if you feel happy, it's okay if you feel sad. And it's important to express ourselves and to feel free to do it and not be ashamed or have fear by saying no.
Gracias,
Thank you.
Bueno,
doctora
yo
González.
quiero
Well,
decirles
Dr.
que
Gonzalez, I would
cuando
just like to
veamos
say
a
that
esas
when we
madres,
see those the gray hair,
recordemos que esa mujer
remember
fue
that
nuestra
that
madre,
woman was our
que
mother,
ella
is now our
estuvo
grandmother,
con nosotros
that
y
she will
es
always be
la
with
jefa de la
us,
familia.
and she's the head of the
Busquemos el
family.
derecho en nuestra sociedad y
And
busquemos la equidad para
look
todos.
for
Feliz Día de
equity
la
for
Mujer.
all of them. Happy Women's Day to all of
Muchísimas
you.
gracias. Agradecemos
Thank you
a
very
todos
much.
quienes
We thank each
participaron
one for
en
your
esta pregunta, que se han
answers
hecho
to all the
con
questions that have been
conocimiento, que
sent
de
with
pronto
this
no
event.
siempre se alcanzan a responderlas
We not always
todos que
respond them,
vamos a considerar para
but we will consider them for future topics in the next
webinars.
webinars. We value for your participation and
Recibimos
interest.
ya, como reitero, que hemos
We
recibido muchas felicitaciones
receive many
en las
thanks
redes sociales.
through the
Nuestro
social network.
agradecimiento especial a
Thanks,
cada una de
special
nuestras
thanks to all our
participantes, reiteramos,
participants and all our presenters for their wonderful presentations. To all those participating to the Horas Konu team, especially to Rob, Milagros, Yadira, who always provide support in this event, to all the people who participate in this activity that made it possible through the commitment to Andean and Latin American integration. And to close, I yield the floor to María Carmen Calle on behalf of the Anna Health Organization and Political Agreement. Go ahead, Dr. Calle. Thank you, Mari. Well, my first words to thank, very deep, profound thanks to Maria Lucia, to Farnas. Thank you, Diana, Juliana. I know you more as Juliana. And thank you, Veronica. Women's Day is a day where we vindicate ourselves, what we are in just to be equal, equality, but we are requesting the same opportunity. We're not asking more or less. We're asking the same according our capacity. It is very clear that we have many capabilities that may be different to those of men. That's not the issue. We also recognize that we need to work together. No problem with that. The only thing that we want is to have girls and adolescents that face life in a better way. And they and respect them and are proud of being women. That being women is no obstacle for their dreams, for making their dreams true. That is what we want. And today we spoke about health and well-being because that's the topic of my organization. I need to talk about health and well-being. I love the approach of the four speakers. You've approached it from different ways, but we came to the same conclusion. This is an issue of rights. This is not because I'm sorry for you and I give you this. No, this has to do with rights. All women, I'm going to talk about Peru, because we have the press release from Peru. We're more than 17 million women in Peru at this moment. We're talking, we are more than 50% of the population, and the presence of women over the age of 60 is more and more important. So if we talk about girls, they need to be empowered. They can value themselves, that they know that they are valuable beings. That's the message. Because once you recognize that you're a valuable person, you're going to take care of yourself. Self-care. There are going to be boundaries. There are going to be possibilities for thriving. As long as that doesn't happen, well, those of us who are here have had the opportunity. I'm not talking about us. I'm talking about those who don't have the same possibilities as we have. At this moment, we have 769 people joining from different countries in the world in this webinar. 81% are women. And we have to recognize that in health sector, the largest percentage is of women. And we need to recognize that women have demonstrated that we are efficient and that we can work well. But we need to help ourselves. What do I mean by this? Combine the work at home. That has always been the issue. Our responsibilities at the home. I'm a pediatrician, but I've done private practice for more than 35 years. And yes, I've witnessed how men have changed. But what was the population group that I saw was upper middle class, high class. So I didn't see in previous years. And there the machismo is still highly prevalent. So we have a large commitment with women. This doesn't mean that we don't recognize the social pressures that men suffer. We need to recognize that they suffer a lot of social pressure. But the Women's Day is a day that we say, fine, where are we? Are we getting there or not? Well, first thing we need to say is there's been progress, but the inequality continues. The women who are making their dreams reality, other women don't. And I love what Veronica mentioned because she made us remember that those elderly women were raised in machismo. So that is a group that we need to pay special attention. And this is a social issue in our country. Priority social, but we need to continue working for women through their life course, girls, adolescents, young adults, and elderly. We believe in the course of life. We know that what we do now has to do with what's going to happen to us later. But we very well know that this is not, what happens to us is not determinant, because as somebody said, I think Farnas mentioned, these are not challenges, these are opportunities. These things can be positive, but we need to be there. Those professionals, most of them who have joined us, are health professionals. Most of them are nurses, physicians, ecologists, obstetricians, workers, educators. They're women. So we have to do our own part also. First, we should not allow that the rights of a girl should be vulnerable. Do not allow that due to their condition of a woman has less opportunities. We should not allow that put women's health in second plane, because women is the only caregiver who are in charge of caring of the health of the family, just women. And that we have clearly seen during the pandemic. Nobody is going to say that more men died. That's true. But the truth is that we should know how we should be clear of how these women become elderly, not only improving their life expectancy. The most important is to have quality of life at the end of your life. And that is not only depends of self-care, it also depends on the government, the states, and the academic institutions, and especially depends on us, because we have a debt. We made our dreams come true. All of us present here are professionals. We've been gone far. We've done things well. So the issue is that we continue supporting so more women can have right to everything, because there's no difference here. Everyone has the right to have a dignified life. Happy International Women's Day. See you next Thursday. And our webinar is going to talk about the cost of the lack of action in tuberculosis. Thank you very much, Marisela. Thank you very much to the whole group of the Horas Konu. And once again, thank you very much, Dr. Gonzalez, Dr. Sabet, Dr. Torrecilla, and Dr. Mesa. See you soon. Bye-bye.